Hi, everyone, and welcome to Shed the Debt. I'm Pattie Lovett-Reid. You know, there is a lot going on right now, and financial stress can really impact you. But do we really know how it impacts us? We have a special guest today, Dr. Eileen De Villa. She was the face and the knowledge behind everything medical during the pandemic, and we have her with us today. Dr. De Villa, I'm not kidding when I say you were the face. But not just the face. You were explaining everything during the pandemic to the average Canadian so they understood what was going on.
Yeah, and that's a huge component of what's required from somebody in a position of medical officer of health, especially during a pandemic.
Right. Yeah, so it's a big deal. And financial stress was very high then, especially when we went into lockdown, not knowing where we were going to um, get our money from, or the government stepping in, etc. We're going through a period of uncertainty in the markets right now. And I guess it really doesn't matter what uncertainty, there is uncertainty.
That's right. And we know that when it comes to income insecurity or economic uncertainty, as much as that has an impact on one's financial health, we know as well that it has significant impact on one's physical health, one's mental health, and one's social health.
And what does that mean? So when you say,
Right.
sure, I mean, I may not be able to sleep at night,
That's right.
but I think I can get through it.
Well, but when you think about it, even having challenges sleeping has its own knock-on effects. If you're not sleeping well, you're not recovering well from whatever mental health challenges or physical health challenges you're experiencing. And when we look at the body of research, when we look at the available evidence on the impacts of financial stress and economic insecurity on health, we see things like shortened lifespan. We see increased rates of chronic disease, asthma, and heart health challenges. We certainly see problems with mental health, and these then manifest themselves in our daily working lives. So you think about that, you're having challenges at work because you're having these physical and mental health problems. Now your job gets insecure, and you can see how this can spiral down very, very quickly into overall poor health across every measure imaginable.
As we rally together as Canadians and say we're proud Canadians, there are some that are dealing with this anxiety right now, particularly if you're a business owner and you're not sure how tariffs might impact you. If you're an individual and your mortgage comes up for renewal and you no longer maybe have a job.
Right.
You know, we look at our productivity here in Canada and it has continued to go down, down, down. Is it in part because of all these stressors that we're dealing with and we can't bring our best self to work every day?
That's right. And there was actually just a study published on this very issue demonstrating that that kind of economic uncertainty does manifest itself in poorer mental health and lack of productivity in the workplace. When our minds are so focused on financial instability, on our ability to actually manage day to day. Can I pay for my housing? Can I put food on the table? Am I able to, manage heat or electricity bills? Am I able to manage emergency issues, urgent purchases that need to be made? If that is, very much part of your day-to-day reality, it's pretty difficult to stay focused on being productive at work. And that serves not only us as individuals poorly, but frankly, as a society, if we're underproducing, right? That's just poor economic health for all of us.
And then if you think about it, there is that knock-on effect with our healthcare system that so many would already say is, I'm not going to say broken, but certainly challenged.
Well, definitely still very much recovering from all that the pandemic brought.
Right.
And the backlog of issues that needed to be managed that couldn't be done because we were busy managing COVID as a health system, and in healthcare in particular. There were lots of care issues that had to be put aside or at least delayed
Right.
while there were more urgent issues. So absolutely, the challenge is this: we see this economic instability and uncertainty. it manifests in more health challenges. And unfortunately, our healthcare system is struggling right now to manage the existing challenges. All this
Yeah.
in light of an aging society where we know, right, things happen. You are more likely to have age-related disease and age-related challenges as we as a society get older and older.
So if I were to summarize that just from my own perspective, what started out when we think about COVID as a health crisis, it was definitely a health crisis, and then it morphed into a financial crisis for many Canadians. And we're still just getting out from under that, and yet we're dealing with new challenges. What should someone sort of look at in terms of I'm not dealing with this financial stress that I may have in my life right now well, that triggers them to say, I need help.
Well, I'd like to think that there is an analogy here between challenges in financial health
Yeah.
and challenges in physical health or mental health. And, one of the first and simplest things that can be done to address those kinds of challenges is to actually seek out professional help.
Mhm.
If you have a health challenge, a very simple thing to do, or at least a good place to start, is to have conversation with a primary care provider, and explain what the challenges are. And I would imagine from a financial perspective, actually getting assistance from somebody who has expertise with managing financial situations would be an excellent place to start as well. It's just interesting to me that whether it's health challenges or financial challenges, from what I've seen and in the experience of other clinicians that I've spoken to, when you have these kinds of challenges, one of the responses that many engage in is actually retreating into oneself,
Really?
not talking about things. And I imagine it's the same
Mhm.
when financial issues are, the subject.
There's a feeling of embarrassment.
Yeah.
People feel that they're not keeping up with the Joneses. Social media plays such an important role where people think, "Oh, why can they do that? I can't do that."
Right.
And this can continue to manifest itself.
And I think it's the same thing when it comes to physical and mental health challenges and social health challenges. You see a lot of imagery and a lot of information
Mhm.
of varying quality on social media. People see others. How come they're able to do that? Why are they in such good health? How come they don't seem to have the same stresses that I do? And then it starts this whole cycle that really devolves very, very quickly and becomes quite isolating.
Are you concerned what is your concern right now, in terms of where Canada is at? And then the knock-on effect are those individuals who are impacted or even business owners.
Well, certainly there's no question. We see that there are reasons to be concerned about our country's economic health, given the many challenges post-pandemic and otherwise. So no question there's those concerns. But, as a public health physician, I'm incredibly concerned about the health status of, the people around us, the people in our community. And for me, what I see are significant mental health challenges, significant challenges with respect to social health and isolation, loneliness, a subject we're hearing more and more about, which has clear impacts on health. And of course, we have chronic disease issues, particularly as we're an aging society. So when we think about all these issues together, combined with some of the economic challenges of our day,
Mhm.
you can
Yeah.
see that these are related to each other. I don't think people put financial health or concerns around the economy in the same bucket as concerns around physical, mental, and social health. But to my mind, these are inextricably linked.
Wow. So, if there is a rallying call to action of somebody watching, reaching out for help, gives you a chance to talk to someone, but what do they do next? Like, I just don't see people saying, I'm going to pick up the phone and I'm going to try to get some help to get out of this situation.
Well, I'm hoping that through conversations
Yes,
like
me
this,
too.
we'll be able to encourage more people to do that. But every major action often starts off with small little steps that move us in the right direction.
Right.
So even simple things like taking a little moment to breathe or to get a little physical activity does wonders for your mental health, gives you the opportunity to actually think about
Clarity.
others.
Others, yes, you clarity.
Clarity of thought.
Yeah.
Then you might actually take that next step towards talking with somebody, be it a financial professional, be it a health professional. It doesn't matter where you start. The point is to start.
I love that. Dr. De Villa, thank you.
Thank you.
I've been joined by Dr. Eileen De Villa. If you're challenged emotionally, financially, physically, mentally, and you need help, take one small step and just reach out and maybe ask for help. Thanks for watching.